Alright, gonna go over fundamentals HESI case study urinary. 43 minutes. Sheesh! Okay, why is it gonna take 43 minutes? Alright, so his name's Hunter Ellis, 76-year-old African-American male, resident in a long-term care facility. He can't control the urge. He's been unable to control the urge to void since experiencing a stroke a month ago. He is alert and oriented, has no verbal deficits since his stroke. Important to know, your first answer is the one that counts as your score. Try again. Okay. We may do good on this, we may not. 5 to 6 times during the night. You get 5 to 6 times during the night in his bladder, but that he was able to control the urge long enough to make it to the bathroom. How should the nurse describe the urinary pattern? He got, sounds like nocturia. Yeah! Dysuria is the pain or burning with urination. Frequency is the voiding at more frequent intervals than normal, but it does not specifically refer to voiding more often at night. Nocturia refers to voiding frequently at night. The incidence of nocturia increases greatly in the older male client who has an enlarged prostate. It may also indicate an inability to concentrate urine because of poor blood flow to the kidney. And diuresis refers to increased urination that occurred taking diabetic medication. Okay, since Mr. Ellis now voids spontaneously without recognizing the need to void, how should the nurse document his current urinary pattern? He voids spontaneously. Ooh, incontinence. Yeah, polyuria, a lot of it. Incontinence, involuntary loss, so you're just pissing, you don't even know. Retention, it's inability to empty the bladder. And oliguria, decrease urine output. So think of oliguria as only a little. Okay, to help manage Mr. Ellis's incontinence, the nurse initiates a bladder training program. Which instructions should the nurse provide to the UAP who will be helping care for Mr. Ellis? Restrict oral intake. No stimulants. Not limiting that. 2 hours. There's no medical necessity to restrict them, so we're not going to do that. These contain caffeine, so they might increase it. Socialization is important. Then they'll get depressed, and then other things will happen. And the toilet schedule is good, so every 2 hours. Good. After several weeks, the bladder training program is unsuccessful in stopping Mr. Ellis's incontinence. Mr. Ellis appears withdrawn and states that he is frustrated at the number of episodes that he is having. Which nursing diagnoses are appropriate for Mr. Ellis? Voiding patterns. But he's going a lot, ain't he? Wait, hang on. Is he coping? He's frustrated. He's withdrawn. I want to say, oh shiz. It's one of these. Maybe that one. Let's see if we got it right. Ugh. Okay, so it's none of these. So it's not this one because the incontinent client. Hold on, coach. Okay, so there we go. Volume. Fluid volume deficit related to voiding problems. Incontinent client does not void excessive amounts of urine. He doesn't? And will not exhibit volume because he's not simply due to incontinence. Client may, however, be at risk for fluid volume deficit carries not sure adequate fluid intake. So he's voiding the normal amount. He's just not recognizing that he's going to the restroom. Okay. Fluid volume excess related to altered urination. Urine does not have fluid. He's just avoiding normal amount. Risk for hyperuric syndrome. Uric syndrome is related to kidney failure and is not a urinary diagnosis. Okay, I think it's these two. Okay. Following an episode of incontinence, a nurse washes the client's perineal area with mild soap and water and applies a water repellent ointment to the skin. Mr. Ellis's wife is present, and the nurse uses this opportunity to educate her about proper skin care to prevent breakdown. The following statements made by Ms. Ellis indicates that the teaching has been effective. Soap and water. Mild soap and water help to cleanse the skin, followed by protective ointment. Why do we not? No, soap's okay. So this statement's wrong, but harsh soap should be avoided. Should not apply any lotion ointment because increased risk. Ointments are okay. Not massaging. You don't want to massage red areas. Can increase the risk of bring down. Oh my god. What the freak is this? The nursing staff continues with the bladder training program. Mr. Ellis's incontinence shows little improvement since the bladder training has been successful. The nurse obtains a prescription to apply a condom cath. Ellis is able to ambulate in assistance. In what order should the prescribed condom catheter be applied? Ellis, order first. Ooh. I mean, I'm assuming clean it. And I'm assuming, wait. I would assume it's this way. Then place it. Boom. Sheesh. Wrap it. Then so it's this. Okay, so before applying condom catheter, it's important to clean and dry the penis. Apply the skin protecting cream that is packed with catheter. Then you'll wrap it. Then you'll place the condom catheter over the glands and roll it gently. Make sure the skin is placed and attached. So clean and dry. Apply the cream. Wrap the boy. Unroll it. And then attach the bag. Gotcha. Safety and infection control. That's our focus here. Mr. Ellis is admitted to the acute care facility for minor surgery. His proper prescriptions include the insertion of the indwelling urinary catheter. Student nurse is assigned to care for Mr. Ellis. The nursing instructor asks the student nurse to prepare to insert the indwelling catheter under supervision. What is the first step in the proper placement of an indwelling urinary catheter for a male client? First step. What do we do? Have we cleaned? Clean. You gotta clean first. First step, clean, boy. You gotta clean, that's so easy. The nurse reviews factors that may impact catheter insertion with the student nurse. Physiological change that commonly occurs in whenever I think of this, I think of BPH, so that one's gotta be. Yep. So urethral stricture narrowing does not occur as a result of the aging process. Stricture can be caused by trauma due to catheterization. Okay, diminished bladder capacity. It occurs due to aging but doesn't affect catheter insertion. It weakens the trusum muscles. May result in incomplete bladder entering but does not affect the catheter insertion. Alright, so you get a 16 French catheter from the supply room. Student nurse explains the procedure to Ms. Ellis, who gives permission to begin. After cleaning, he maintains sterile technique while inserting the cath into the urethra, for instance, while inflating the balloon, cries out, "Oh shit, the balloon ain't in all the way." Deflate that balloon and insert. No, you can deflate it. You could remove it, but it's a smart thing. So you want to deflate it first and then go a little bit further. Alright, documentation. Catheter successfully placed in the bladder with a return of 200 milliliters of clear yellow urine. Catheter secured and Mr. Ellis is resting comfortably. Documenting the catheter insertion procedure, which statement should be included. Well, what do we want to know about it? I mean, we want to know. Yeah, you could. I mean, I don't know. The nurse should document that the catheter was inserted with difficulty, but prostate gland knowledge cannot be assumed. Can't assume it. This is important because it gives us the data. Okay. Oh, because it still thinks it's still in the... Okay. Continent. This is not the most pertinent information. It's not important. No shit. Mr. Ellis turns from the PACU after her surgical procedure. He has an IV of LR infusing at 125 milliliters an hour, O2 at 2 liters per count, and an indwelling catheter attached to the drainage bag. 4 hours later, the nurse documents the milliliters IO. LR station running for 4 hours, and the nurse administers IV antibiotic that runs in 150 milliliters of saline. It's still in PO. How does the nurse document intake? So... I mean, is it 650? Yeah. Mr. Ellis is responsive but confused and frequently pulls on the urinary catheter. Observes obvious hematuria, blood in the urine, and drains by notice the presence of several blood clots in the tubing. How should the nurse document the situation? Client doesn't know what he's doing. Surgery caused the client's confusion, resulting client's confused and pulls on your catheter. Urine is pink reddish blood clots. Striking my opponent's catheter, now it's bleeding. Shit. That's fucked up. Don't think that one. Surgery caused client confused. How do we know? I think this one. Yeah. Does not provide the most pertinent objective situation. That could have been fine. That's kind of fucked up. Doesn't know what he's doing. Messed up. Not provide the most objective picture of the current situation. Not provide the most objective picture. This one is complete. Okay, cool, dope. Next. Mr. Ellis's hematuria. 2 hours. Hematuria continues. He becomes restless and appears to be in pain. Nurse observes that there has been no urinary output during the last 2 hours. Which assessment should the nurse complete first? Assessment. Oh, this is evaluation. This is an assessment. Is there any distension? Maybe? Oh, shit. Not first. He's restless and appears to be in pain. Measure it? Okay. Ooh, wow. I even said this wasn't it. Vital sign measurement will provide useful information, but it's not first thing. So why are we doing this one first? No in 2 hours. I remember that. Because he may need... Okay, I think I understand. The nurse is unable to resolve the catheter obstruction using non-invasive measures and notify the healthcare provider who prescribes bladder irrigation, dislodge any blood clots obstructing the urine flow. The nurse anticipates that the prescription will include the use of which sterile technique to irrigate the catheter. Normal saline. Acetonic solution. Makes sense. You don't want to use this. RN encourages the student nurse to perform the irrigation. The student prepares the solution, applies gloves, clamps the distal tubing, begins to clean the specimen port on the drainage tubing. Actions the nurse take. I've never done this one. Maybe. Huh. He's doing it right. Okay. I didn't know why. It's not necessary. No need to keep it. Okay. Nurse instills a total of 60 mils and withdrawals 40. Nurse then empties 200 milliliters from urinary drag. This takes out 40. Yeah, it's 240. Maybe, question mark? Oh, 180. So that's... I'm lost. How? Oh, because... Nope. Still lost. Sure. Are you good, bro? Safe and effective care environment. During the catheter irrigation, the nurse observes that still confused and attempts to pull it out. His IV and his nasal cannula tries to pull them all out. The nurse considers the use of the wrist restraints on the basis of which rationale. See, look, but why is he at risk for self-injury? It's confusion, right? See, but... See, it's at risk for self-injury. It's not a specific reason. Okay, fair enough. It's not a good reason to use restraints. Okay, I got it. The nurse notifies the healthcare provider and obtains a prescription for restraints. The nurse applies the restraints and plans to decline every 30 minutes, which assessments are most important. Skin integrity. Mean shit. More. Why? What's wrong with him? Yep. Damn, it's a tough one. Alright, it's like physiologic adaptation. Confusion decreases, and 12 hours later, the nurse is able to remove. There's 12 hours. By a third post-op day, no further hematuria or blood clots are observed in the urine. However, the nurse that the urine has developed a cloudy appearance. What action should the nurse do? I mean, you can remove it. Should not remove it unless prescribed by the doctor. No urgent. Okay. Test that boy. Draining well, no sure. No, okay. Still draining well. No indication for further urinary retention. Okay, I think I understand that. This is labs, I'm assuming. So labs 8.5 pH, specific gravity 1 point. That's kind of, no, this is fine. Protein no, glucose none, white blood cells 8, red blood cells 2, bacteria is present based on your analysis. Why would we? I want to say the food. Reducing intake? Why are we giving cranberry juice? Oh, the pH high? 4.6 to 8. Oh, crap, you're right. You're right, I didn't know. Which diagnostic test would make the nurse concerned that the client is at risk for sepsis? Uh-oh. There's a certain thing that does it. Oh, shoot. Sepsis is, isn't that I know exactly what sepsis is. It's like bacterial infection. What's the one? I think of that. Nope. Is it that? Oh my god. Microorganisms causing resistance to antibiotics. Sepsis. Okay. Pharmacological and parenteral. After reviewing Ms. Ellis' diagnostic test results, the nurse consults with the health provider and receives a prescription for new antibiotic. Since Mr. Ellis' creatine level is elevated, the nurse is concerned about which problem in administering medication. See, creatine. Oh my god. I don't know. What does creatine do? Creatinine. Oh shit. No. We don't know about low albumin levels though. I think that. If you tell me it's this one. That one? Okay. Elevated creatinine says there's a problem with the kidneys. Kidneys are unable to excrete drug molecules effectively. The drug will remain contained in the body. Okay. And it's not this one because it does not reflect any problem with medication absorption. So it just does with excretion. Force pass does not affect me. Okay. Dang. A nurse notes that the medication dosage is in the safe range for elderly clients, which is to be administered by IV every 12 hours. She recognizes the frequency of drug admissions based on which following. I mean, half-life? Yeah. How many hours? 2. 8. Oh, sheesh. Right. To encourage voiding, the R instructs UAP to perform what intervention? So you can't. No, it's fudged up. Tap water is running. Use. I think that one. Makes sense. Pharmacological and parental therapies. Mr. Ellis voids after the catheter is inserted, and he is discharged from the acute care facility and transferred to the long-term care facility. He no longer has an IV. Prescription for his antibiotics is changed to oral med. Has some difficulty swallowing. So the best thing to help swallow it. Capsule mix it with what determine. Shit. I don't ever open those. The nurse consults the pharmacist, who determines that the capsule can be opened and mixed with the food that the client likes. Applesauce. Something. Oh. No. Nope. Oh, shoot. I would say pudding, because you don't want to crush it. Wait. Yeah, see, you don't want to crush. Just mix it, my boy. So, okay, just care. Incontinence continues using catheters resume until Mr. Ellis has developed local dermatitis. Catheter removes temporarily remote healing, and although the nurse's stats after 2 hours, he occasionally wipes the crying. Why is he crying? I'm gonna ask my guy, why are you crying, bro? When Mr. Ellis is calm, several minutes later, the nurse walks down the hall and sees the UAP in the room changing. Mr. Why are you changing? Here's the room. Why is nurse room temperature? Soap opera is playing. It's kind of. Whoa, bro. Wait, he's getting bro, is the door open, bro? I didn't read that. I'm stupid. Okay, nice. How we do? Oh no, boy. Who? You hate to see it. Alright, was that one?